Welcome, and thank you for choosing Ascension St. Thomas for your joint replacement surgery. We're excited to be your nurse navigators to assist and support you through your surgical journey and to help walk you through this joint class video. The purpose of this class is to help you feel informed, organized, and well prepared before your upcoming surgery.
You'll learn how to get ready for your procedure, what to expect during your hospital stay, and important information for after your surgery. You will also get some important tips to make sure your transition from the hospital to recovering at home is as smooth as possible. So let's get started. I am sure you have learned a lot about your joint and why your doctor has recommended you to have your joint replaced. Please take some time to look through the section, What is Wrong with Your Hip or Knee, in the Living with a Hip or Knee Replacement book, provided to you at your preoperative appointment. In this section, you will read information about your joint and the parts that will be replaced. If you have specific questions about your implant, please reach out to your surgeon. Preparing for surgery. All joint replacement surgeries need some preparations in order to achieve the best possible outcomes. Watching this video helps ensure you and anyone assisting with your care are prepared for your surgery and recovery. In your home, make sure there are clear and wide pathways. Be sure to remove any throw rugs, area rugs, or anything else you could potentially trip over. Be aware of any uneven surfaces and use caution when crossing them to prevent falls. Put items that you use frequently at waist level. In your bathroom, place a non-slip mat in your shower or tub. Now, getting in and out of bed can be difficult after surgery. We recommend you check your mattress height before coming into the hospital. You can do this by standing next to your mattress and seeing where the mattress hits you on your body. This will help the physical therapist practice with you in the hospital. If you have stairs at home, a physical therapist will also practice with you on how to properly use them. The best type of chair to sit in after surgery is a chair that has armrests. This could be a wingback chair, dining room chair, or office chair. Just make sure it doesn't have wheels on the bottom. We don't want the chair to get out from under you. You can also sit on the couch. Just make sure to sit on a side that has an armrest on it so you have a place to help push yourself up. Right before surgery, clean your home, wash your bed linens, clothing, and towels. It is also important to prepare meals, gather supplies, and groceries. To help you heal effectively, good nutrition is extremely important before and after surgery. Arrange for someone to help care for your pet if necessary. One of the most important things to do before surgery is to choose your coach. This can be a family member, friend, neighbor, or you can have multiple helpers. Your coach will need to drive you to and from the hospital and drive you to any appointments after surgery, including outpatient physical therapy appointments. Medical equipment to help with recovery. You may need some helpful items at your home to keep you safe and comfortable. Getting them in advance of your surgery will ensure you have time to practice using them. Most surgeons recommend patients start out using a front-wheeled walker, not a four-wheeled walker. This helps to provide stability and helps to prevent falls. The commode riser, shower chair, and hip kit are helpful items for after surgery, but they are not required. If you have the standard low toilets, the commode riser can be placed over it to make it easier to get on and off of. The shower chair can be placed in the shower if you feel like you may need to sit down at any point during your shower. The hip kit consists of a sock aid to help you put your socks on, a long-handled shoe horn to help you put your shoes on, a reacher to help pick up any items you may have dropped, a garment hook to help you pull up your pants, and a long-handled sponge to help reach areas that you may not be able to reach. Your stay in the hospital is not long. Some patients go home the same day, while others spend one night. Your surgeon should let you know of the plan before surgery. Whether you plan to go home the same day or spend one night, still pack an overnight bag just in case. Pack things like your personal hygiene items, toothbrush, toothpaste, deodorant, etc. A couple of outfits, loose-fitting clothing like a t-shirt and shorts, or loose pants. With your shoes, you want them to have a good rubber sole with a back or a strap. Please no flip-flops. If you have a walker already, bring it to the hospital so we can make sure it is a safe walker for you and is adjusted to your correct height. The preferred walker is a walker that has 2 wheels on the front. If you wear glasses, contacts, hearing aids, or dentures, make sure you bring your cases for them and put your name on it. If you have sleep apnea and use a CPAP machine, bring the machine, mask, and tubing. Bring a pack of sugar-free gum to chew after surgery. This is part of our ERAS program, which stands for Enhanced Recovery After Surgery. Please see the brochure that was provided to you at your preoperative clinic appointment. We also need you to bring your medication list. Avoid bringing your own medications to the hospital unless you were specifically told to do so. Your medicine will be provided by the hospital. If you have a living will or durable power of attorney that you forgot to bring to your preoperative appointment, you can bring that and we will scan it into our system. The hospital has free Wi-Fi, therefore you can bring your phone, laptop, or tablet to use in your room. Before surgery, it is important to clean your skin with the surgical soap that was given to you in the preoperative clinic. This helps reduce your risk of infection. Instructions on how to use this soap were provided with the information at your preoperative appointment. You will begin using the surgical soap once a day, starting 4 days before surgery and on the morning of surgery, for a total of 5 uses. Use this soap to wash your body from your neck to your toes. Be sure to get everywhere you can reach. Ask for help if needed. Do not use this soap on your face, hair, or genital areas. You can use your regular soap and shampoo for those spots. Please do not use the surgical soap if you are allergic to it or have a history of any skin conditions such as eczema, psoriasis, contact dermatitis, etc. Use an antibacterial soap such as Dial. Please use a mesh poof or clean washcloth and towel for each shower, and please remember on the day of surgery, after your last shower, do not put anything else on your skin or in your hair. This includes lotions, ointments, makeup, nail polish, perfume or cologne, deodorant, or hairpins. Change your sheets and pillowcases on your first day of showering with the surgical soap so that you sleep on clean bedding. Change your pillowcases and sheets again the night before surgery. Do not shave within 48 hours prior to your surgery. Do not eat or drink after 11 p.m. the night before your surgery, except you can have clear liquids up until 2 hours prior to your arrival time. This includes the pre-surgery drink, if you were given that in the pre-op clinic, and clear liquids such as Gatorade or G2 for diabetic patients, black coffee or tea, do not put milk or cream in it, water, apple juice, no apple juice for diabetic patients, soft drinks or diet soft drinks for diabetic patients, eat a light supper, don't eat anything too heavy, greasy, or spicy. The day before your surgery, you will get a call to confirm your arrival time. Day of surgery. You will need to park in the Seton garage. You can park on any level of that parking garage. You will just need to take the elevator to the level D or hospital. Take the sky bridge across and check in at the admitting desk. Once you arrived at admitting, they will check you in for your surgery. From there, they will bring you to the second floor where the family waiting room, holding, surgery, and recovery room is. Getting ready for surgery. Your care team will ask you some questions to confirm your health history and medications. You will change into a hospital gown, and when the holding team is ready for you, they will bring you to the holding room where they will get you ready for surgery. An IV will be inserted into your arm. You will meet with your surgeon and anesthesia team. Your surgeon will mark the correct side you are having surgery on. The anesthesia team will discuss the type of anesthesia they will be using. We use two different types of anesthesia, spinal and general anesthesia. Both are great options, but how they decide which one you will receive depends on your surgeon, health history, and what surgery you are having done. The care team will connect you to the monitor, where they will monitor you before, during, and after surgery. This process may take around 1 hour. The surgery times vary depending on each patient, what procedure you are having done, and your surgeon. The average time for a total knee or hip replacement is usually around 1 hour to 1.5 hours. If you are having a knee or hip revision, it is around 2 hours. And if you are having both knees or hips replaced, the surgery is around 2.5 to 3 hours. After surgery, you will go to the recovery room, also known as the PACU. In PACU, you will be closely monitored as you wake up from anesthesia. The nursing staff will help you stay comfortable, and family or friends will be notified of your progress. You may see some tubes and equipment such as oxygen, vital sign machine, IV fluids, Foley catheter, or a surgical drain. The recovery time can differ depending on each patient, but it is typically around 1 to 3 hours. Post-op. If your surgeon discussed discharging home on the same day of surgery with you, the nurses and physical therapist will assist you with getting dressed, walking with the walker, and preparing for your discharge home. If your surgeon discussed staying overnight in the hospital, you'll be transferred to your room on the nursing floor. Your surgeon and care team will help determine when it will be safest and most appropriate to discharge you. It is important to start walking as soon as possible after surgery. Walking reduces your risk of blood clots and pneumonia, prevents stiffness and soreness, builds muscle, and improves overall health. You may feel weak, so have assistance and use your walker until your therapist or surgeon says you no longer need it. Do ankle pumps and use the incentive spirometer every hour while awake after surgery. Doing ankle pumps helps with blood circulation to help prevent blood clots. Using the incentive spirometer will help prevent pneumonia after surgery. Some patients may have a drain present after surgery. Your nurse will monitor this and remove it when it's necessary. Your care team will remove the surgical dressing and place a waterproof bandage over your incision. Instructions on how to care for your bandage will be discussed with you in your discharge instructions. Please read through these discharge instructions again when you are at home. It does have very important information that you need to know about your recovery. The physical therapist will take you to the gym on the unit. There, they will teach you how to go up and down stairs, how to get in and out of a car, and if you have a tub shower combo at home, they will practice that with you as well. You will be ready to go once you have met your discharge goals. Those are: your vital signs are normal, you are able to urinate, pain is controlled with oral pain medicine, and you have safely worked with physical therapy. If you spend the night in the hospital, please have someone at the hospital by 8:30 that next morning. Most patients are discharged by 10 a.m. Pain management. After surgery, you will not be pain-free. The goal after surgery is to have your pain at a tolerable level where you can still perform daily activities. The pain after surgery is different from the pain before surgery. The first 2 weeks after surgery are the roughest with the pain. Take your pain medication as prescribed. It is important to take your medication before you have severe pain so that it has time to start working. While in the hospital, you will need to ask your nurse for pain medicine since it is on an as-needed basis and not a scheduled medicine. Swelling also causes pain. Use ice packs and elevate your legs to keep the swelling down. Constipation is a common side effect when taking narcotic pain medication, and many experience constipation after a joint replacement surgery. After surgery, you are not eating, moving, or drinking like you were beforehand. Therefore, your bowel movements may be different. Staying hydrated, getting up and walking, and eating well-balanced meals can help prevent constipation. Once you leave the hospital, you will need to use over-the-counter stool softeners or laxatives to also help prevent constipation. You will continue to use these medications as long as you are on pain medicines or your bowel movements are regular again. After surgery antibiotics. After your joint replacement surgery, antibiotics may be required before any invasive procedures such as dental cleaning, oral surgery, or some other procedures. Please consult with your surgeon on their specific recommendations. After surgery, patients are at an increased risk for developing a blood clot. Your surgeon will prescribe you a blood thinner to take for a short period of time after your surgery to decrease your risk of developing a blood clot. A complication of a blood clot is a pulmonary embolism, when a piece of the clot breaks off and travels to your lungs. Although developing a blood clot or a pulmonary embolism is rare, please be aware of symptoms and notify your surgeon immediately. Symptoms include increased swelling, warmth or tenderness of limbs, sharp calf pain, shortness of breath, increased heart rate, palpitations, or chest pain. Infections after joint replacement surgeries are also rare. However, you should continue to take precautions to avoid infections after you are discharged. Keep pets, kids, and hazards away from your incision area. Wash your hands often to reduce germs, and follow your discharge instructions from your surgeon. You now have the important information to prepare you before, during, and after your upcoming surgery. Please refer back to this video or to your Living with a Knee or a Hip Replacement book if you need a refresher on anything that was covered. Be aware you will receive many phone calls from the hospital and physician offices as your surgery nears. Please return all calls in a timely manner. We are eager to make this process as simple as possible for you, so please contact your nurse navigator with any questions. Thank you for choosing Ascension St. Thomas for your upcoming orthopedic surgery. We're ready to help you get back to the life you love.